everyone, I'm Jennifer Williams and I am so glad to be with you today. I am here, I'm going to say this sentence very quietly and very quickly, but summer is coming to a close, which means it's time to get ready to go back to school and back to sports. We are so happy to welcome Dr. Peter DeLuca, orthopedic surgeon and team orthopedist for the New Jersey Devils. Dr. DeLuca is here to share his best advice to help keep your child safe and healthy as they head back to sports. So if you have a question for Dr. DeLuca, just drop us a comment below. We'll be sure to try to answer those at the end of our program today. So now please help me welcome Dr. Peter DeLuca. Dr. DeLuca, hello.
Oh, thank you, Jennifer.
Thank you.
Thanks for having me.
Thank you so much for being here. Can you believe it's August 31st?
Can't believe it. Summer flew by and it's fall.
It's fall and we're ready to go back to school. Some people have even started school already and back to sports, but let's just jump right in. So tell us a little bit about the work that you do with athletes.
So I'm a sports medicine physician. Now there's different type of sports medicine physicians. I'm an orthopedic surgeon, so I tend to operate on various athletic injuries. There is also the non-operative sports medicine physicians who are they're either family practitioners or internal medicine or physiatrists, and they take care of mostly the non-operative sports injuries. So as a sports medicine physician, it's multifaceted. You cover games, so you are there managing the injuries on the field, and to be honest with you, that's probably the best way to get a great diagnosis is when the injury first happens, before you start to get a lot of swelling, you get reactive spasm around the joint, so it's hard to examine the joint. But when on the field, you can get your best examination. But we then make a decision on the field whether the player can go back or not, whether we need to get additional testing done on that athlete. So that's an exciting part of being a sports medicine physician, especially if you love sports,
course,
which I think you go into it because you love sports. Then there's seeing the patients in the office. So they hurt themselves, they probably went to the emergency room or an urgent care center, and then they come in about a week after their injury, and then you again have to evaluate it and probably get some additional testing, either x-rays or MRIs. Then there's the pre-participation physical part of it, where you examine players and athletes and see if you can pick up anything that might lead to an injury, and then start some sort of preventative exercises for that. So it's a bit of prevention, diagnosing, and treating.
Love it. That's awesome. And as an athlete, it's so important to take care of yourself. So we've got a lot of nice information to share with you today. So we did say some people are already back to sports already, but what should athletes and parents kind of start thinking about and prepare as they do go back into their sports?
Preparation is so important in preventing injuries. And as an athlete myself, and you were an athlete, right? When you get to the sport, you think that you can just jump in and just be good at it, but you really can't. I mean, the preparation should start probably at minimum 6 weeks before they start training camps, and you need to work on your flexibility. Children tend to not stretch as much. They think they don't have to. They're limber, they're agile, they don't need to stretch, but they really do, more than probably the older person, because their bones grow faster than their tendons and muscles do. So because of that, their muscles and tendons are tighter and stiffer, and that leads to muscle pulls and strains. So they really need to stretch. They have to work on their flexibility. Work on their flexibility from their head all the way down to their ankles. Every joint, they should work on stretching. And then strengthening. A lot of people forget about strengthening, other than maybe football players who are forced to go into the weight room. But other athletes don't think they need to strengthen. I run a lot, my legs are strong, but that tends to fatigue you. So you need to build up the endurance in your muscles and the strength. And you have to do some dedicated strengthening exercises. And you don't need a lot of fancy equipment. You can do a lot of these in your basement, in your bedroom. There's no excuse. You should be able to do them. And that's the preparation for the season. And then you start to do what we call sports-specific exercises. So then, like soccer players will start to work on dribbling and shooting and passing type of things. Football players will do these skill patterns that they can do. And it's all designed to kind of create what they call muscle memory.
Yeah, I was just gonna just say the same thing.
So
yeah.
your muscles know how to and when to cause a change in direction, and all of that has been shown to decrease the risk of injury.
Yeah, and you're gonna ring in my head, because stretching is something that I lack in doing, but it is so important. I teach spin class and bar class, and I dance, and sometimes we forget those things, or like you said, you kind of just go, okay, I'm doing all this all day already, it's fine, but you really have to take care of yourself from head to toe.
A great example is Tom Brady. He's 45 years old and he's still playing at a very high level. And if you look at his workout routine, a lot of it is just stretching. It's stretching and diet. That's basically it. He probably doesn't, I don't think he lifts weights that much. I think it's more some body weight strengthening, yoga, Pilates type of things, but a lot of it's flexibility.
And all of that stretch based, yeah. So, in addition to stretching, what are some ways, that we can prevent injury as athletes?
So, it's funny because we use the word prevention, but I think it's a little bit of a misnomer.
Okay.
Because I don't know if we can absolutely ever prevent an injury from sports. Because there's just inherent risks in the sport itself. But there are ways to reduce the incidence of injuries. And some of them we just alluded to.
Yeah.
Keeping yourself flexible and strong. Hydration. Hydration is so important in preventing injury. People don't realize that. Because as your body gets dehydrated, your muscles fatigue faster, they get tighter, and that can lead to injury. Also the electrolyte imbalance that occurs with dehydration, that causes your muscles not to contract properly, which then can result in some instability of your joints and cause injuries such as ACL injuries. I had a player, he was a wide receiver. We were at a conference, he was helping out as a guest, and it was towards the end of his career, but he told me that in the beginning of his career, he did have a lot of muscle injuries, hamstring pulls, groin pulls, and then he started to really pay attention to his hydration. And once he did that, he said he had no more soft tissue injuries. I mean, it can be that dramatic by paying attention to your hydration. So in summary, to prevent injuries, you want to maintain your flexibility, strength, and concentrate on your hydration. If you're in a sport that involves contact, make sure that you have proper equipment and you're wearing them properly.
Yeah, that's important. And can I ask you a question about, we're kind of programmed, we need to start taking in a certain amount of water every day, and especially as athletes, we should be taking in more. Should we only be drinking water? Should we be drinking things with have electrolytes in them, like a Gatorade or a Powerade or something like that?
That's a good question, because, you could overhydrate yourself, which could be just as bad as dehydrating. And what happens there is you just drink water, and we know water doesn't have electrolytes in it. So if you drink a lot of water and you're losing a lot of electrolytes, what happens is it dilutes your blood.
Okay.
And so you get decreased sodium, for example, which can cause some problems, not only in your muscles, but even in the conduction of your heart. So, as a general rule that we like to go by, one is you want to not lose more than 2% of your body weight in a practice and a game. And now, even though it's fall coming up, we clearly showed that it's still warm.
I was going to say, the weather is still
right,
fickle.
It's still hot, it's very humid, and so you tend to lose a lot of fluid. And there's some athletes that they can lose like 10% of their body weight in one practice. So what you want to do is weigh yourself before and after. And if you've lost about 2% of your body weight, then you should realize that you need to drink more. If you've lost more than that, then you probably should not participate in another practice until you regain that weight. And that's all water weight. So you want to just work on the fluid. Now, what type of fluid you use, you can either just do a mix of water and an electrolyte drink, or one other thing you want to pay attention to is the quality of your sweat, or the kind of sweat that you have, as gross as it sounds. But if you're wearing, for example, a dark shirt, and after you play, you notice that there's a white stain on it, that usually means that you're losing a lot of salt.
Okay.
So you're a person that is losing a lot of electrolytes in their sweat, and that has to be replaced. So you probably would want to drink more of the electrolyte-based
Okay.
sport drinks like the Gatorades and the Powerades.
Wow, see this, you learn something new every day, everyone. And I know we've talked a lot about stretching a little bit, but could we go a little bit more? Do you have any recommendations around stretching? You know, what we should be implementing and making sure we take care of, like, are there specific stretches we should be doing, certain amount of time?
So, stretching is variable depending on the patient's own body makeup.
Mm-hmm.
There are some people who are loose jointed or double jointed and probably don't have to stretch as much
Mm-hmm.
as opposed to the person who's a little bit tighter.
Mm-hmm.
In general, I would say that a student athlete should probably stretch at least 3 to 4 times a week. And if you're one of those that are just generally tight, you should stretch every day because it has absolutely been shown scientifically to reduce the risk of injury.
Mm-hmm.
And what stretches you should do, like I said earlier, start from your neck and work down to your ankles. And you only have to do one stretch.
Mm-hmm.
Hold it for about 15 seconds. If you don't hold it for 15 seconds, then it's not going to do anything. It's like saltwater taffy. I always give an example. If you try to pull it once, it's not going to stretch out. Whereas if you constantly put pressure on it, eventually it stretches out.
Yeah.
And that's what that same thing happens with our tendons and muscles. So you need to work on those exercises for at least 15 seconds.
Mm-hmm.
Now, if you are an athlete that involves a lower extremity, like a soccer player, you may want to concentrate a little bit more on the hips and do 1 or 2 other stretches in addition to that one stretch. So maybe a total of 2 or 3
Sure.
To work on their hips.
Mm-hmm.
But I think just one stretch per body part and holding it for 15 seconds is good enough. The other thing is you should never stretch a cold tendon. Same principle with saltwater taffy.
Okay.
If you hold the saltwater taffy in your hand and your body weight heats it up, it softens it up and makes it easier to stretch.
Mm-hmm.
So same thing with our muscles. You have to increase the temperature. So you need some warm up. So like a 5-minute jog in place, something where you start to feel your body temperature increasing.
Makes sense, yeah.
And when your core temperature increases, maybe even you sweat a little bit, that's a sign that you're probably warmed up enough that you should start stretching. Don't stretch a cold muscle.
Yeah. Oh, I'm learning so much today, everyone. And let's talk about a little bit about nutrition too. What should athletes be adding to their diet, excluding from their diets?
I mean, exclusion is simple. Junk food, high sugar. Those simple sugars you probably should avoid from your diet because they actually make you a little more tired. In general, it's just in moderation. I mean, everything should be in moderation. I don't think you need more one type of food group as opposed to the other. I think in general, in the sports that require strength, like football, you want to take more protein in, and that should be done in the preseason, a little bit during the season. Before games, in general, you also want to be carbohydrate load a little bit. So eat a lot of foods that have high in carbohydrate, like pastas. They have been shown to give you a little more energy in the short term. And you need some fats. Fats are a very good source of energy, just not too many of them.
Yeah, I was gonna say, I know a lot of athletes do those pasta nights and things before their big games and stuff.
You just in general want to be able to take in a little bit more calories than you expend.
Makes sense, yeah.
To keep up your body weight, and because we've seen so many problems with eating disorders, especially in females. They have something called the female triad, where they work out a lot, they expend a lot of calories, but they don't take in the same amount or more. So it affects their body, it affects their hormones. They start to have problems with their menstrual cycle, which then affects their calcium and vitamin D, and they start to have problems with their bones and end up with stress fractures. So, nutrition is very important. Like I said earlier, that's what Tom Brady. I'm always amazed at the pictures they show of him when he came out of college to what he looks like now. It's so dramatic how his body fat has decreased, and he looks so much better now. And that's why he was playing at such a high level.
Yeah, that's why people call him the GOAT. But in this area, we necessarily may not like him so much. And you touched a little bit on this at the beginning, but sports physicals, why is it so important to make sure? And you said, we were talking before, they're mandatory in the state of New Jersey to do so.
Yes, in the state of New Jersey, not only are they mandatory, but an orthopedic surgeon cannot do clear an athlete to participate. It has to be done by an internal medicine or their pediatrician. And there's a lot of important reason for that is unfortunately we are still seeing some young kids die of sudden cardiac death on the playing field. And that's usually secondary to a cardiomyopathy, which then leads to an arrhythmia, and that's how they die. So some of that can be picked up a little bit on the physical examination, but mostly the history. You know, a good history by someone who is familiar with sports, you know, asking the right questions about family history, about, you know, whether they get dizzy with excessive activity, things like that. And if they have a high index of suspicion, then they can order other tests like an EKG or an echocardiogram, which hopefully will then make the diagnosis and prevent a death. I mean, that's how important this is. The other is asthma. You know, some kids don't know they have asthma. They just, you know, they think they're out of shape. They get short of breath, they think they're out of shape, but they might have asthma. Just listening to their lungs and hearing some wheezing could be enough where they said, you know what, you have to be treated for this. And then it's dramatic how much better they feel. They don't feel tired, they don't feel winded, they can run longer. So that's an important part of the physical. And then from an orthopedic standpoint, we look at things that maybe we can predict when a person's going to get injured and work on that body part to hopefully prevent injuries. Like I said earlier, there are some people who are double jointed, and that's a good and bad thing. It's kind of a double-edged sword. It makes you a little bit of a better athlete because your joints have more range of motion, but you also are more prone to injury. So if you see an athlete that is double jointed, I would really stress that they do a lot of strengthening exercises because our muscles around the joints will also stabilize the joint and compensate for the loose ligaments. So if you see that on the physical examination and address that, that can eliminate some injuries. Or if a person's tight, you know, their hamstrings are tight, not only can that affect their hamstring strains, but people with tight hamstrings, particularly young kids who are very active in sports like football, they could also get a stress fracture in their back, and one of the reasons is they have tight hamstrings, believe it or not. So if you can pick that up on an exam, I think that'd be very helpful.
Sure, so make sure you go, you know, it's a hassle, sometimes you don't want to stop your summer to go to the doctor, but it's so important to, you know, that it really will help keep your child safe, and, you know, that's so important in sports, because there's so many factors that, you know, could come up, and we just want to be as safe as we can. So I just want to ask you too, like, are there signs or concerns that athletes should be aware of that may put them at risk for injury?
You know, athletes are very competitive by nature. That's why they're playing a sport. And they want to play. And they'll cover up a lot of things. And they won't tell you some things. So, but, you know, I think if an athlete feels tired, their muscles are fatiguing, that could be a sign they're dehydrated, and which can lead to injury. So they should, you know, pull themselves out of that activity and work on their hydration. Pain is an indication that there may be something going on. You shouldn't play through pain. I know people want to be tough and they want to show their coaches that they can play through things, but you know that has been shown to lead to injury. And coaches nowadays understand that. They're not going to degrade you or punish you because you go to them and say, hey, look, my knee hurts a little bit today. It should be evaluated. And there are some things that we could say, you know, no, it's okay, you can probably play better, or we can treat this and you can still play. But there are some things that you pick up that you say, oh, wow, this could have been made worse if you continued to play through this. So it should be evaluated by their school athletic trainer, and their trainer then could maybe refer them to a physician if they think it needs further evaluation. So I would have to say that it's definitely any muscle fatigue, muscle soreness, or pain around a joint. The athlete should notify their coach and or athletic trainer.
Sure, yeah, and they're certainly there to help you, and never let anyone tell you to play through it.
Absolutely not.
We don't want to hear that. That is no. That is a no.
That's the old school thinking.
No.
We don't do that anymore.
And you know, you touched on it too. You said, you know, kids tend to sometimes, or athletes in general, they want to just keep going and doing it. But as a parent, what should they be looking out for?
You know, parents know their children better than anyone else. And even though an athlete may not tell them, sometimes there's things that the parent will pick up on. Now, I don't deal with concussions, but one sign of concussion is a change in their mood or their affect. And if you don't know the child, you may not pick up on that.
Yeah.
But obviously, a parent knows their child. So if the parent sees that they're not acting correctly, they should, inquire about it and ask them if did they take a hit to the head, and if should they be seen by their pediatrician or their family doctor to have that evaluated.
Sure.
The other is, parents sometimes can pick up if the athlete or child is not using a certain extremity. And embarrassing as it seems, being an orthopedic surgeon, I had that situation with my daughter, who was an athlete, and she didn't tell us, but she was wrestling with my son, her older brother, and then she didn't say anything. And then one day we were at a pool, and we were watching her, and she was only using her one arm to swim. So we said, "What's wrong?" And she was, "Oh, my shoulder hurts." And it turned out she had a fractured clavicle.
Oh wow!
So if you notice, yeah, I know, that was embarrassing. But if you notice that they're not picking up the utensils with one hand, and they're normally right hand, they're using their left hand, and more inquire about it. If they have a little bit of a limp, or if they're not lifting certain things that you knew they would lift before, inquire about it. And I think once you do that, then I think that the child will open up, and then it can be evaluated.
Yeah. Trust yourself, trust that you know your child, and that make sure you have that relationship so they can come to you and talk about those things for sure. And Dr. DeLuca did touch on concussions. We do have a wonderful screening program here at Cooperman Barnabas, so we're going to drop that link in the bio for you. So if you see something wrong, we've got that as a resource for you. And what are some other injuries that athletes should be cautious of? Each sport comes with a different set of potential injuries that arise, like ACL and all that kind of stuff. So what are some things that we should be aware of and cautious of?
The most common injuries that we see, particularly this time of the year in training camps, in the beginning of seasons, are soft tissue injuries. So muscle strains, sprains. Now, a sprain is just a word we use to describe an injury to a ligament. There's different grades of sprains. There's grade 1, which is what everyone considers a sprain, no structural damage to the actual ligament. A grade 2 sprain is where there's partial tearing, and a grade 3 sprain is a complete tear. And the same thing with a strain. Everyone hears those words and they automatically think it's just a minor injury.
It's okay, yeah.
Right, it's just a strain, it's just a strain. But what's important is the grade of those, because you could have a grade 3 strain, which is a complete tear of the muscle, but we still call it a strain. But those are the most common injuries. And again, the way to prevent those are you keep up your hydration and your flexibility.
Sure.
There's other ones that we see, particularly in football, unfortunately, is like you said, ACL injuries. I think there's close to 20 in the NFL now since preseason started. So it's very common. It's mostly a non-contact injury, and it's not a subtle thing. I mean, when you tear your ACL, the athletes will hear a pop or a crack. They have swelling, their knee feels unstable to them. There are some exercises to prevent those type of injuries. Again, I use the word prevention, but there's no way to prevent them. There's a way to decrease the incidence. And these exercises have been shown scientifically to reduce the risk of ACL injuries, about 52% in females and 85% in males. The thing is you have to do them. And what I would like to see is coaches allow time before practice. All you need is 15 to 20 minutes. You don't need any heavy machinery or equipment on the field. They can do it under the watchful eyes of the athletic trainer, so they're doing them properly, because it's not just that you're doing them, you have to do them correctly to work. And I think if they allow them to do them a couple of times a week before practice, and that's not going to impinge on their practice time, we're going to see a dramatic decrease in the incidence of ACL injuries in these high school and college athletes. Again, it comes down to doing it.
Making these things part of your routine.
Absolutely. Yeah, there's no excuse why a coach should allow that small amount of time, and they do work.
And take care and take ownership of yourself and your own body. Get to practice 15, 20 minutes earlier, and do these things just to make sure that you're prepared as you can be to protect yourself.
Yes.
I think that's so important too. We always have to advocate for ourselves.
Yes. And wearing equipment's there for a reason. It's designed to protect you. So you should wear it. Wear it and wear it properly. I still see athletes who don't like to wear their, like football players wear their thigh pads or knee pads. They're there to help you,
Yeah.
and you should wear them.
Do all the things to protect yourself.
Yes.
So we recently published an article that was referencing a term that I had never heard called sports specialization. Can you tell us a little bit more about that?
Yeah, that's a very hot topic.
Okay.
And the definition of sports specialization is when a young athlete, and that is a pre-adolescent, someone who's 12 years old and younger, who participates in an intensive training program or just one sport for more than 8 months out of the year. And they just solely do that, and they exclude all other sports. The impetus behind that is that people feel that they could get into colleges better. But there are risks. I mean, studies clearly show that in sports specialization, there's a higher incidence of injuries. Not only that, physical, but there's the mental side of it. Burnout. I've seen it so many times. It's a sin. I had this one athlete who was a soccer player, and she was really good. I mean, she was so good that when she was a sophomore, they told her she couldn't really play her high school team.
Oh, wow.
And she had offers from colleges when she was a freshman.
Wow, my gosh.
But unfortunately, she tore both ACLs. And after her second one, I was in the presence of her and her mother talking, and her mother's trying to pump her up. You'll be fine. You came back from your last one. Everything will be okay. And she said, "Mom, I don't want to play anymore." And her mother said, "What do you mean? You love soccer." She said, "No, I don't." I goes, "I did it for you and Daddy.
Oh my gosh.
I don't really love the sport."
Oh my
And
goodness.
so at that point, I think she was a senior in high school, and she was basically already burnt out. Mentally, she was burnt out. And that's what sports specialization does. But these coaches and parents feel that the risks are an acceptable means to an end, which is athletic performance, college scholarships, maybe long-term financial gains. And none of the studies have shown that by participating in these sports at a young age, you don't get into colleges more often than the ones who do not participate. And the other opposite studies that shows that people students who participate in multiple sports actually do better psychologically, physically, and socially. They have better development in all those factors. So I think it's hard, but I think we have to educate coaches and parents that sports specialization is not what it's cracked up to be, and there's more detrimental things that can happen with it, and that you should strongly encourage your child to participate in multiple sports. And there's actually been studies out there that shows when they should get into one sport. One study looked primarily at soccer players and hockey players. And for hockey, they thought by 13 years of age, it'd probably be okay to play that one sport. Soccer was 15 years of age. They really didn't look at any other sports. And I've seen it we actually did a study when I was down in Philadelphia with all the sports teams. And we polled them and asked when they start, and did they just play in one sport, what injuries. And we found the same thing as everyone else, that most of these professional athletes did not do sports specialization.
Oh, wow.
And they could reach the level of professional level.
I think that's important for people to hear.
If you had one or two that did sports specialize, they did have more injuries as a younger child. So I think there's enough evidence out there that you really should discourage that whole practice.
Wow. Well, I think that is a great place to end today, and I think that we should, we want everyone to have, be safe and have fun. Most importantly, have fun.
Absolutely. That's what sports is. I mean, sports it's so much fun. It should be fun. It teaches you a lot of life skills, teamwork, dealing with disappointment, anxiety. All of that's important to get in life. And I want you to participate in sports, but it should be fun. You shouldn't be forced to do something.
Yeah, you have to love it. You have to want to get up and do it every day.
Absolutely.
That's the NARCA. So if you do, hopefully everyone stays as safe as they can. But Dr. DeLuca is one of the best, and he is here for you. So if you need more information, or you want to contact him, or you need to schedule an appointment, his phone number is 973-322-7005. So I'll say it again, 973-322-7005. We're going to put that in the comments for you. And what a nice discussion. Thank you for taking time out of your schedule to be with us today.
Thank you for having me. This is great.
I know, it's so fun.
was
I'm
fun.
glad we got to do this. So stay safe, everyone, and have a great school year.